in a nutshell, for people that don't even know or been not paying attention to the news, what is the coronavirus?
So coronaviruses are very common viruses. There's 4 of them that commonly affect humans. They cause about 20 to 30% of common colds. This novel coronavirus is similar to SARS, severe acute respiratory syndrome, or MERS, Middle Eastern respiratory syndrome, in that it's one of the coronaviruses that can cause a severe infection. So most coronaviruses cause a cold in the upper respiratory tract, sore throat, fever, runny nose. But these more severe coronaviruses, including this novel one, can also cause infection in the lower respiratory tract, in the lungs, and then patients can have pneumonia, and it can be quite severe and can actually die from it.
That's what makes it different than like SARS or other.
Yeah, well, SARS can do that too, and MERS can do that too. So those 3.
Up and upper.
Yeah. So the SARS, MERS, and now this novel coronavirus are the 3 severe coronavirus strains that are really of concern.
How much right now should people pay attention to what's happening?
Well, I think people should pay attention to the news. There's very limited transmission right now in the U.S. Almost all the cases that have been detected in the U.S. have been imported, people getting exposed abroad and then traveling here and becoming symptomatic. So there's been very little person-to-person transmission outside of China. But it has been reported, and it's possible that there could be more widespread transmission.
Should people take precautions right now?
I think the main precautions people should take is what they should always do, is to avoid getting sick with any respiratory virus, including the novel coronavirus as well as influenza. And so you shouldn't be around sick people. So if you see people coughing or sneezing, move away from them. Most of these respiratory viruses, including the novel coronavirus, will be transmitted by being within 6 feet of somebody coughing or sneezing. So you want to get away from them. You want, hopefully, people coughing or sneezing use cough etiquette, cough into their sleeve, not into their hand, which would then spread it everywhere. Wash your hands frequently. Those are all good things to do, but people should do that all the time. We know that influenza, for example, there's been about 15 million cases already in the U.S. this season and about 8,000 deaths. So people are dying from influenza, so we need to protect against that too.
Is there any sort of vaccine right now for the coronavirus?
There is no coronavirus vaccine yet. There are several laboratories who are working on that. With the 2002-2003 SARS outbreak, people started work on coronavirus vaccines, and they got pretty far along. They still have those, so they're resurrecting those vaccines to kind of get a head start on this. But unfortunately, when that outbreak was over, there was no further funding for those vaccines, so they weren't developed further.
Is there a particular demographic that's more vulnerable to the coronavirus?
Yeah, so almost all the patients that have had severe infection ended up in the ICU, and the patients who've died have been older individuals, so those older than 50. Most of them have been men, and almost all of them have had underlying medical conditions such as diabetes, heart disease, or lung disease.
So theoretically, a more healthy person has a better chance of surviving this, so to speak, and getting healthy again.
Theoretically, younger, healthier people will handle the virus better, but there was a death reported in a 39-year-old, so it can be severe for anybody.
The other big thing that's going on is you're starting to see people wear masks around. In particular, people have seen these. Are those helpful at all in perhaps preventing the spread if you happen to come in contact with someone?
So masks are useful. They're mostly useful for when people are sick, them wearing it and not transmitting to others. They can be useful in protecting yourself against getting infected, but the problem is you have to wear them almost constantly, and you have to wear them appropriately, and you can't like reach under the mask to scratch your nose or anything like that. Then you're like totally bypassing it. So it's not really feasible for most people to wear them all the time. So I'm not recommending people wearing a mask to protect themselves.
At all?
No, only if you're like, only if you're like a healthcare worker and you're being directly going to talk to somebody who's coughing and sneezing, then we would prefer that person to be wearing a mask, and then the healthcare worker will too, to try to prevent spread.
So is it pretty much just you're wasting your time doing it?
I think unless you're really committed to it, unless you're going to wear it all the time, then it's probably not going to decrease your risk.
Say if someone is like, no, I'm going to wear a mask. I don't care what anyone says. They're defiant. Are there any particular kinds of masks that you could recommend, like particular, like this one here that you
Yeah,
get at
so-
a home improvement store?
So these ones, you'll notice they'll say N95, so that means they'll filter out 95% of the infectious pathogens. Not 100%, but 95%, so that's good. And that's better than, for example, the regular surgical masks that you see. Those are usually more rectangular that cover the face and tie it behind. Those don't do 95%. There's a lot more gaps there, so things can go kind of around and under the mask.
So, Doctor, bottom line here, when might we see this threat end here with the coronavirus?
I don't know. This can go a couple different ways. So it's possible that with all the screening that's done and travel restrictions that are in place, it's possible that there'll be very limited transmission in the U.S. And that it'll go away, kind of like SARS did. And on the other hand, it does seem pretty infectious, and there's probably people who are already infected and out and about who've not been detected yet in the U.S. And so it's possible that this could just become a routine infection, kind of like H1N1 did. It just like entered the population. Pretty much everybody's susceptible to it, and we could have widespread transmission.
Do the travel bans, in fact, work to hold back the virus?
Travel bans have never worked. Travel bans, it seems like a good idea at the time. It seems logical. The politicians love them. But the issue with the travel bans is that the viruses don't respect borders. People get out anyway. The infection does get out. The travel bans, what they do is they tend to slow the spread, but they don't stop the spread.